Dangerous impact of bacterial infections on human health. Bacterial infections are becoming increasingly common and pose a serious threat to human health. These harmful microorganisms are responsible for a range of illnesses, from minor skin infections to life-threatening conditions such as pneumonia and meningitis. The impact of bacterial infections on human health is dangerous and can result in significant suffering and even death. Antibiotics have long been the primary treatment for bacterial infections, but overuse and misuse have led to the development of antibiotic-resistant strains of bacteria, making infections even more difficult to treat. In this video, we will explore the dangerous impact of bacterial infections on human health, the causes of antibiotic resistance, and what you can do to protect yourself and your loved ones from these harmful microorganisms. 1. Understanding bacteria and their role in infections. Bacteria are tiny, single-celled microorganisms that can be found practically everywhere, from soil to water, plants to human bodies. While many types of bacteria are harmless or even beneficial to humans, some can cause serious infections and illnesses. Bacterial infections can range from minor, such as a mild skin infection, to life-threatening, such as meningitis or sepsis. Certain types of bacteria are also becoming increasingly resistant to antibiotics, making them harder to treat and posing a serious threat to public health. Bacteria can enter the body through a variety of ways, including inhalation, ingestion, or through breaks in the skin. Once inside the body, some bacteria can produce toxins that cause damage to cells and tissues, while others can replicate and spread throughout the body. Understanding the role of bacteria in infections is crucial in preventing and treating these illnesses. Proper hygiene, such as washing hands regularly and cooking food thoroughly, can help prevent the spread of harmful bacteria. Antibiotics are often used to treat bacterial infections, but it's important to use them responsibly to avoid contributing to antibiotic resistance. Overall, understanding the dangers of bacterial infections and taking steps to prevent them is essential in protecting our health and well-being. 2. The impact of bacterial infections on human health. Bacterial infections can have a severe impact on human health and can lead to serious health complications if left untreated. These infections can range from mild to life-threatening, depending on the affected area of the body and the type of bacteria involved. Common bacterial infections include strep throat, urinary tract infections, and pneumonia, among others. Some bacterial infections can cause long-term health problems, even after the infection has been treated. For example, untreated strep throat can lead to rheumatic fever, which can cause permanent damage to the heart valves. Pneumonia can cause scarring in the lungs, making it difficult to breathe even after the infection has cleared. In addition to the physical impact, bacterial infections can also have a significant emotional and financial impact on individuals and families. They can cause missed school or work, prolonged hospital stays, and expensive medical bills. It is important to seek medical attention if you suspect you have a bacterial infection. Early diagnosis and treatment can help prevent complications and improve the chances of a full recovery. Additionally, practicing good hygiene, such as washing your hands regularly and avoiding close contact with sick individuals, can help prevent the spread of bacterial infections. 3. Common types of bacterial infections. Bacterial infections are caused by harmful bacteria that can invade and multiply within the human body. These infections can affect any part of the body, causing a range of symptoms that can vary in severity. Some of the most common types of bacterial infections include 1. Urinary tract infections, UTIs. These infections occur when bacteria enter the urinary tract, causing symptoms such as pain during urination, frequent urination, and fever. 2. Respiratory infections. Bacterial infections that affect the respiratory system can cause a range of symptoms, from a mild cough and cold to severe pneumonia. Some common respiratory infections caused by bacteria include strep throat and tuberculosis. 3. Skin infections. Bacterial infections of the skin can be caused by a range of bacteria, including Staphylococcus and Streptococcus. They can cause symptoms such as redness, swelling, and pus-filled blisters. 4. Gastrointestinal infections. Bacterial infections of the gut can cause symptoms such as diarrhea, nausea, and vomiting. Some common bacterial infections of the gut include Salmonella and E. coli. 5. Sexually transmitted infections, STIs. Some bacterial infections can be transmitted through sexual contact, such as gonorrhea and chlamydia. These infections can cause symptoms such as pain during sex, discharge, and pelvic pain. It's important to seek medical attention if you suspect you have a bacterial infection, as these infections can quickly become serious if left untreated. Your doctor may prescribe antibiotics or other treatments to help clear the infection and prevent complications. 4. Symptoms of bacterial infections. Bacterial infections can range from mild to severe, and the symptoms can vary depending on the type of infection and where it is located in the body. Some common symptoms of bacterial infections include fever, chills, fatigue, muscle aches, and a general feeling of being unwell. Other symptoms may include pain or swelling in a specific area of the body, such as the throat, ears, or sinuses. Bacterial infections can also cause digestive issues, such as nausea, vomiting, diarrhea, and abdominal pain. Skin infections can cause redness, swelling, and tenderness, and may also result in the formation of pus-filled blisters or sores. In some cases, bacterial infections can cause more serious symptoms, such as difficulty breathing, confusion, and seizures. It is important to seek medical attention if you experience any of these symptoms, particularly if they are accompanied by a high fever or severe pain. It is also worth noting that some bacterial infections may not cause any symptoms at all, particularly in people with a weakened immune system or other underlying health conditions. This is why it is important to practice good hygiene and take preventative measures, such as getting vaccinated and avoiding contact with people who are sick, to reduce your risk of developing a bacterial infection. 5. The importance of proper diagnosis and treatment. When it comes to bacterial infections, proper diagnosis and treatment are crucial. Unfortunately, many people tend to ignore the symptoms of bacterial infections, thinking that they will go away on their own. However, bacterial infections can be dangerous if left untreated and can even lead to severe health complications, such as sepsis, organ failure, and even death. That's why it's important to seek medical attention as soon as you notice any symptoms of a bacterial infection, such as fever, chills, cough, fatigue, and pain. A healthcare professional will be able to diagnose the type of bacterial infection you have and prescribe the appropriate treatment, such as antibiotics or antifungals. It's also important to finish the entire course of antibiotics prescribed by your doctor, even if you start feeling better before the medication is finished. This is because stopping antibiotics early can lead to antibiotic resistance, which can make future bacterial infections harder to treat. Proper diagnosis and treatment of bacterial infections not only help to prevent complications and protect your health but also reduce the risk of spreading the infection to others. So, if you think you may have a bacterial infection, don't hesitate to seek medical attention and follow your doctor's instructions for treatment closely. 6. Steps to prevent bacterial infections. Bacterial infections can be serious and, in some cases, life-threatening. However, there are steps you can take to prevent them. Firstly, good hygiene practices can go a long way in preventing bacterial infections. This means washing your hands regularly, especially before handling food or after using the bathroom. You should also avoid sharing personal items such as towels, razors, or toothbrushes, as this can increase the risk of spreading bacteria. Secondly, it's important to keep your surroundings clean and sanitized. This includes regularly cleaning frequently touched surfaces such as door handles, light switches, and countertops. It's also important to properly store and handle food to prevent the growth of bacteria. Vaccinations can also help prevent bacterial infections. For example, the pneumococcal vaccine can help protect against pneumococcal disease, which can cause pneumonia, meningitis, and other serious infections. If you have a weakened immune system or a chronic health condition, it's important to take extra precautions to prevent bacterial infections. This may include avoiding large crowds or sick individuals and practicing good hygiene habits. Overall, taking preventative measures can help reduce the risk of bacterial infections and protect your health. We hope that this video has shed light on the dangerous impact bacterial infections can have on human health. While many bacterial infections can be treated with antibiotics, the overuse of these drugs can lead to antibiotic resistance, which can make these infections even more difficult to treat. It is important to take steps to prevent bacterial infections in the first place, such as practicing good hygiene and following food safety guidelines. Remember, prevention is always better than cure, and taking the necessary precautions can go a long way in protecting your health. Thank you for watching, and we wish you good health and comfort.